Another big picture item that I tend to discuss with patients when it comes to the physical aspect with fascia, abnormal biomechanics, all that stuff is imagine, those big red and white radio towers that come up, they're a couple hundred feet tall and they've got these big long guide wires on them. Typically it's got, somewhere around like four that go on each direction, just like a tent, for camping. Um, if you were to say snip and just cut one of those wires, um, what's going to happen? Either the tower is going to shift a little bit, or it'll stay where it needs to be. And say the wind blows in a certain direction, the other guide wires are going to have to make up for that lack of support from that one that got snipped. And so I like to use this analogy describing when muscles become functionally inhibited through some sort of painful stimulus, whether that's from an injury or, in the functional medicine side of things, some sort of visceral complaint. So each organ has muscles that are associated with it. So if you have a gut issue, for example, your TFLs or your tensor fascia lata muscles, they're going to turn off, and that's what can cause tightness of the IT bands, and it can cause some low back pain. But at the same time, say you are playing, basketball and you just fall onto the hardwood floor and you hurt your hip a little bit. All of the muscles or guide wires off of that hip that you fall on are going to turn off. And so all the other muscles that are holding that hip where it needs to be are going to have to make up for that lack of force from the muscles that are turned off. When this happens, that's where improper biomechanics begin. And even if it's not something that's visible as like a limp or some sort of gait change, it can be as minute as just the hip is sitting just ever so slightly different within the socket. And it just causes a little bit of extra or not enough tension on some of the ligaments and muscles that are holding that hip where it needs to be during movement. And this can lead to pain. With this, it is very difficult to, on your own, resume normal biomechanics, and that's where, with say like physical therapy, doing rehab type stuff, getting those muscles turned on has to be the first step. And this is even for anybody that's listening at home. It's not just go see a doctor, go see a physical therapist, whoever you're going to go see for help with this. It doesn't necessarily need to be just that. It is identification of what muscles aren't working properly, and there's a lot of physical screens that you can do to do this.